So the next topic is I also would like to talk about different type of headaches. So I always forget the treatment for different types of headache. So different type of headache, there is tension, migraine, and cluster. Tension headache is mostly in women, migraine mostly in women, and cluster mostly in men. Cluster is episodic, but it's only lasts up till 180 minutes. Migraine, very long, 72 hours. We all know cluster is like everything around the periorbital region. Tension is compressive, non-pulsating dual headache, and migraine is pulsating. So for the migraine treatment, you have this lecture will be separated into 4 parts. First is what do we use for abortive therapy. Second, prophylaxis. Third is trigeminal neuralgia and postherpetic neuralgia, peripheral neuralgia, other type of treatments, other type of headache treatment. And the third is pseudo tumor cerebri, because it also gives you headache, right? So abortive therapy, so the pathology behind migraine and cluster headache, because they vasodilates, they vasoconstricts, right? And then after vasoconstrict, the vessel vasodilates. The vasodilation of those vessels are actually causing migraine or cluster headache. That's why we're giving the vasoconstrictor, which are triptans and argot, for abortive therapy, right? And remember, those are vasoconstrictor, so do not use in cardiovascular diseases, hypertension, and pregnancy. And then, so abortive therapy is sumatriptan and argot for migraine and cluster. The only difference is 100% oxygen for cluster. Migraine is you can give NSAID. Talking about NSAID, another headache you can give NSAID is tension headache. And tension headache, you can also give TCA, amitriptyline. Internal prophylaxis, every time you have more than 3 attacks per month. For migraine, you can give beta blocker and TCA. Cluster, you can give verapamil. We use prednisone for injection or any anti-seizure drug, mainly valproic and topiramate. Remember, again, sumatriptan and argot for both migraine and tension. Cluster for treatment, 100% oxygen for cluster, NSAID for migraine. Tension is for NSAID and TCA. TCA can also be used as a prophylaxis for migraine, but it's not the first line. The first line is beta blocker. Cluster is calcium channel blocker, anti-seizure drug, valproic and topiramate. That's the first 2 things you have to do. The second one is the unique one is for tension headache. So we didn't talk about tension headache that much. And then tension headache, we are using NSAID for the acute, right? But if it is chronic, if you're having half a month, you've been having headache, like half of the month you have headache for 3 months, you can like try TCA instead of NSAID. So TCA is prophylactic, abortive. TCA for tension can also be used as prophylactic and abortive, right? But TCA can only be used as a prophylactic for migraine. Remember that. And the second part is, we all know trigeminal neuralgia, we use carbamazepine. Any type of neuropathic pain, gabapentin, pregabalin, and TCA. The third one, this one becoming highly. So pseudotumor cerebri, the first line is weight loss and acetazolamide. And never use long-term steroids or long-term LP. You use these as a short term to bridge into surgery. Surgery is the only definitive treatment if it's not get better with weight loss and acetazolamide. Surgery is optic nerve fenestration or ventricular peritoneal shunt. So again, just pure memorization. Know what are abortive, prophylactic, neuropathic pain, pseudotumor cerebri.